Hi there, my name's Angela Farrell from Nyberg Pharma, and today I'd like to run through the product training for Allpresan Diabetic Foot Foam Cream. So, a little bit of background about diabetes. There are currently 3.2 million people diagnosed with diabetes in the UK, and a further 850,000 have diabetes, but they're either not aware or they're undiagnosed that they have the condition. 80% suffer with some form of diabetic skin problem, and that's due to their high blood sugar levels. And these skin problems are most visible on the feet and legs. Typical symptoms include extreme dryness, calluses, pressure ulcers, cracks, fissures, foot fungus, and bacterial infection. Here are some typical examples of problems associated with the feet in diabetes. Dry, cracked, split heels is very common, and callus formation on the soles of the foot, which can be very, very sore at times. Dryness between the toes is very common, and if left untreated, can lead to fungal and bacterial infection and ultimately ulceration, as demonstrated here. Treating and preventing dry neuropathic skin is a major challenge because when the skin is broken or cracked, the environment is rife for fungal and bacterial infections, and therefore daily care must include an appropriate skincare regime, and that will replenish the skin's moisture but also protect the skin from outside influences such as bacteria. Any area that is not protected on the feet, including between the toes, poses a real risk of infection as bacteria can enter through the skin more easily. The advice given to people with diabetes about the use of moisturising creams is not to use them between the toes, as this additional moisture will make the skin even more susceptible to bacterial growth and increase the risk of infection. So, what is Allpresan Diabetic Foot Foam Cream and why is it different? Well, we have two products in the range. Allpresan Intensive is 10% urea base and is a preventive treatment for very dry to cracked skin at risk of infection and ulceration for customers with diabetes mellitus. We also have Allpresan Basic 5% urea, which is a preventive treatment for dry, sensitive, parchment-like foot skin at risk of infection and ulceration in customers with diabetes mellitus. They are both presented in 35 and 125 ml options. Both products are recommended for use between the toes, and this is unique to Allpresan foam creams. They can be used around any wound edges and also over the whole foot. So how does Allpresan foam cream work? Well, it's simply more than just a moisturiser. It's been clinically formulated to treat and prevent the dry skin on the feet, reduce the cracks, reduce the buildup of hard skin and calluses, and ultimately protect against infection and ulceration. Now, this is achieved because of the actively breathable formula plus the unique moisturising complex of urea, pentavitin and panthenol. When the foam is applied, it forms a two-dimensional protective mesh on the skin, so the skin is able to breathe and normal skin functions are maintained. The skin is protected and it stays intact, and the foam absorbs really quickly, leaving no occluding layer on the surface of the skin, and there is no increase in bacterial growth. So Allpresan is really unique in protecting against the real risk of infection between the toes. The unique moisturising complex of Allpresan foam creams make them particularly effective moisturisers, providing optimum hydration to the feet. The water content of the foam cream evaporates more quickly from the skin surface than conventional creams, resulting in a higher concentration of the effective substances of urea, pentavitin and panthenol, giving better absorption through the skin. Allpresan foam creams work very quickly, and you can see from the graph here that in just 7 days there was over a 50% increase in moisture content in the skin, and this really helps with compliance of the product. The moisture levels continue to increase for up to 8 hours, which means that the skin does not dry out between applications. And this is important because the skin needs to stay moist and protected for as long as possible so that damage does not occur, which could lead to possible infection. Allpresan foam creams last twice as long as creams and ointments, and you'll see from this video that the foaming action creates a 10-fold increase in volume from the foam cream compared to a normal cream, making it particularly economical in use. Allpresan foam creams provide moisture and not grease to the skin. And you can see here the light and airy consistency means that once it's applied to the skin, it can easily be spread over the whole area very, very easily. And you can see it gets absorbed very, very quickly. These two videos demonstrate how Allpresan is absorbed without greasiness. The first one is looking at a conventional cream, and you can see that the foot is slipping because of the grease on the surface of the skin. The second one is Allpresan foam cream, and you can see there is very little grease left compared with a conventional cream. The pressurized container means that Allpresan is hygienically and accurately dosed, is protected from contamination, and there are no preservatives necessary. The overall assessment of Allpresan foam creams in a study using 20 patients showed that 100% would recommend Allpresan to another person with diabetes. So in summary, Allpresan Basic and Intensive are preventive treatments for the whole foot. They've been developed with patients in mind to treat dry, cracked skin, reduce hard skin and calluses, and leave the skin soft and supple. Remember, they protect against ulceration and infection. And most importantly, they can be used between the toes, around any wound edges, and on the whole foot. So here are a few simple instructions as to how to use Allpresan. You need to shake the can well before each use, and make sure you hold the can upright when applying the foam and not to tilt during use, because if the container is held downwards, it can lose pressure. And lastly, you'll see from this diagram that Allpresan foam creams can be used at all levels of risk. Basic is used where there is low risk of ulceration, and Intensive is used at all other levels of risk as indicated by the arrows. Well, that's the end of the product training. I really hope you've learned a lot about Allpresan, and I'd like to thank you very much for listening.